So I'd like to start with why SkinIntegra was created. Our founder, Erica Tasbaric, developed it after her husband's battle with diabetic foot syndrome. He suffered painful cracks that ultimately led to a series of amputations. And as a J&J chemist with deep experience in skincare, Erica was struck by the lack of safe, effective solutions for diabetic skin. She studied what makes the skin slower to heal and designed a comprehensive barrier repair formula that delivers rapid, lasting relief. That formula is now patented and has been recognized with the APMA seal of approval for its foot health benefits. And while Erica's husband's story is a tragic one, it gave rise to Erica's purpose and to SkinIntegra and SkinIntegra's purpose, which is helping other patients with diabetes find faster, safer healing. So that's how SkinIntegra was created. And now here's Dr. Parthasarathy with what it means for patients in practice.
Hey everyone, thanks so much for joining us today. I'm very passionate about this product, passionate about the company. I've seen significant results in my office, and that's why I'm here today. I'm very picky on who I partner with. I really need to believe in the product. I need to trial the product. And as you will see, hopefully by the end of the webinar, the reasons why I switched to SkinIntegra. So there's key benefits of SkinIntegra, right? So as you can see by these lovely pictures, which are very profound for patients, faster healing. So it heals pedal fissures than urea 40. It reduces infection risk. We will back that up with some clinical stuff coming up in a few minutes. It's safe for at-risk patients. So it's safe for diabetic, neuropathic, post-surgical, and fragile skin. So it doesn't have any of those additives sometimes that you see, like salicylic acid, things that you would think twice about in a high-risk patient. And then it streamlines care. It's kind of like your one-stop topical, or it's turned into that for me. So it's one product for fissures, for surgical scars, and for all patients. So it doesn't matter if your practice isn't just diabetic care, if you are doing surgery, this one product actually does lots of different uses. And so we'll go through that. So as I mentioned, it heals fissures faster than urea 40%. It reduces the post-op scarring when used after suture removal, safe for diabetics, and it restores hydration and strengthens the skin barrier, which we'll talk about the specific ingredients in the next slide. It also protects high pressure areas from cracking and friction. And again, it streamlines care. So one product for multiple needs. So why is this so special? Next slide, please. So three big things here. So it restores the skin barrier. So diabetic skin isn't just dry skin. It's actually deficient, and it's deficient in key barrier components. So lipids and nutrients. I find that this is what sets this cream apart from other competitors. Those deficiencies really slow healing, and it increases infection risk. So SkinIntegra figured out how to replenish these missing elements and restore the barrier in a way other moisturizers do not. And so it precisely mimics healthy skin. So it uses a specific ratio of lipids, urea, and lactic acid and antioxidants. I call that the secret sauce. We all call that the secret sauce. And so that's what sets this cream apart. So the ratio is designed to mimic the balance of healthy skin. And so it creates that right environment for healing and repair, and it sets it apart from traditional urea-based cream. So I was at the APMA National, and I was just talking to my colleagues about, what they are using. And so traditional urea-based creams, it's like Cura 42, the ammonium lactate, all the things that we would prescribe or have over the counter. And so why should we switch over from that, right? If that's been working for you? Well, we want to keep up with the best products for our patients. So this product is safe for everyday use. It's fragrance-free, So it's free of all those things, listed there: fragrance, dyes, parabens, preservatives, and salicylic acid. It's non-greasy. So the biggest thing that my patients say is they don't mind putting it on. They like putting it on. Ammonium lactate leaves this pasty layer. Other urea-based creams can sometimes stain their bed sheets. I don't know if patients complain to you about that, but my patients are like, well, I don't really like the feel of this cream. And so it's really comfortable, and it's good for sensitive and compromised skin. Patients can actually use it daily, which really improves the outcomes. And it also has antioxidants in it: vitamin C, E, magnesium, and zinc, copper. Important to go back to that restores the skin barrier. We're concentrating on diabetics here. It's not just diabetics that have this compromised skin barrier. A lot of patients with Sjogren's, psoriasis, their body is not producing those key barrier components, and they have the skin dysfunction. Next slide, please. Now, everything I do, all the articles I write, even when I lecture, I always go back to the literature and clinical practices and clinical guidelines. So SkinIntegra actually has clinical evidence to date, supports what we're seeing and hearing from our doctors and patients. So in this randomized, university-led study, SkinIntegra outperformed Urea 40 in healing pedal fissures with faster results, great patient comfort, and fewer side effects. So you can see significant faster improvement in dryness, cracking, and pain. And there is also less irritation with extended applications. We want something that the patients can continue to use. So yes, as a podiatrist, number one, I am a physician and looking at the clinical trial. So I like that it's double-blind, randomized, 48 subjects, decent, but I would have liked a larger clinical pool, but this is a great start. And so looking at this, this clinical evidence-based product. So the key points to remember about this: it's a rigorous study design, it's independent and university-led, and SkinIntegra showed faster. That's very important in these high-risk patients, right? We don't want them to keep using a cream for months and months before they see improvement until the fissure gets infected. We want faster healing with less irritation with extended use. So the results were presented in the 2024 APMA National Meeting, and it's going to be published in JAPMA this summer. Has it been published yet? Not yet, right? Okay.
Not yet.
Okay, upcoming, so fall, hopefully. And then the study was led by podiatrists and validated by patient feedback. So I love that they have this. Now, looking at the real patient case studies. I love this part because the pictures definitely do justice to this product. So next slide, please. So this is one of the newest case studies. I always want to trial products. I want to make sure they are working. I want to dispense it in my office, and we'll talk about how to do that later. But I want these patients to get better quickly. So here is this 57-year-old female. She has a history of flaky, dry skin. Nail cultures were negative for fungus. Those are her comorbidities. Now you see that she has like a broad diagnosis of autoimmune inflammation. What is that? We are not sure. She was just told that they're not sure what autoimmune disease she has, but she has something. She's not being treated for that, okay? Now, she admitted to only applying this cream once daily. Look at the impressive results within 6 weeks. I also did not debride that skin either. And she was, again, not on any biologics and no medication changes for 6 weeks. I actually gifted her this cream because I wanted to see if it would work, right? We want to test these products. We want to make sure before we switch over, and not even I have switched over. I dispense it in my office, but I want to push the product to its max to see what the clinical results will be. And look at this. Now, that area at the bottom there, that is a wart. So I have to take care of that. So she's coming back for that. Now, yes, I gifted this patient the product. She brought so much of it. She, bought it for her friends and family because she was embarrassed. She had this dry, flaky skin. she would find it in her bed sheets. So she was very, very happy with the results. So this is one of my most recent patients. Next slide. Now, how profound is this one too? So my good friend and colleague, Dr. Langone, who is very well known in our profession, she shared these photos with a patient, a 72-year-old female, plaque psoriasis, over 50 years, resistance to topical and biologics. Those are her comorbidities. She actually applied it twice a day. And this was, again, follow-up within 6 weeks. 6 weeks of usage. I mean, I was blown away. I have also used it on patients with psoriasis. I've used it on patients with Sjogren's, eczema, a lot of different skin barrier dysfunction disorders, and have seen excellent results. Of course, we're not saying only use this, right? But definitely good as an adjunct treatment. And this patient was resistant to topical and biologics. So this is profound. Next slide, please. So here, 2 pictures that are actually pretty, it's very significant. It's in the SkinIntegra brochures, and I love for patients to take a look at these pictures because they usually identify themselves with these, you know, the heel fissures. Post-surgery, they look at that and be like, oh, my incision looks like this. And so it's nice to transition over why to use this. So, you know, we've seen diabetic heel fissures healed in 1 to 2 weeks. Post-surgical scars benefit from early hydration and barrier support. We know that, you know, we need to hydrate. We need to, especially for surgical scars, you want to get started on something. And again, as I mentioned before, I've used it on patients with psoriasis, very dry skin. Chemotherapy is another one as well that also affects the skin barrier dysfunction. Sjogren's, and one big one is post-healed venous stasis ulcerations. So the common issue in these conditions is a skin barrier dysfunction. And so in my practice, again, the usage has not been limited to diabetics. I've seen significant results in many conditions. So I operate quite a bit, and post-surgical scars, especially in my patient population, is extremely important. My patients care about their scars. They want it to look nice. So usually I would refer them to silicone sheeting, Mederma, Aquaphor, but it was just not enough. So I've incorporated this into my post-op protocol to start massaging their scars after the sutures has been removed and the skin has epithelialized and closed, and I've seen fantastic results. So hopefully this will be a future study that's in the works so we can get some clinical data behind that as well. Next slide. Here are some examples of some other cases, but before that, I had mentioned venous stasis ulceration. So, you know, especially with these webinars, you're always on the fly because you never know what happens that day. So I saw a patient this morning in the office, and she has significant venous stasis ulcer changes to her legs. She's been my patient for many, many years. We've gone through many different things, venous ulcerations, just pain from swelling, that, you know, the pigmentation. So we had just finished healing her up for an ulceration. And the last visit, I gave her SkinIntegra. She purchased it, and I said, okay, now we're going to use this for maintenance. I don't know why I hadn't given it to her earlier, but she was really upset today. She said, I can't believe that you gave me this product like, you know, a couple of weeks ago. Why didn't you give it to me earlier? And I said, well, oh, I'm sorry, you know, like I should have, who knows? But I said, well, what did you notice? She's like, remember that burning skin feeling that I had? I was like, using the SkinIntegra significantly improved it. She's like, you need to tell all your patients about this. And this was an unprompted visit from this morning. And she is a true believer. And I've really noticed post-venous stasis ulcerations that it really maintains the skin barrier extremely well. And in this patient, it also got rid of her mild burning and itching sensation, which is likely due to, swelling and the venous stasis changes. And because the skin is nice and hydrated, she's no longer feeling that. So just, off the fly case study this morning. Also, I had a patient actually, before I go to that, let me just finish the slide because I can just keep talking about patient stories. So here you see cracked, calloused toes and then heel fissures. I mean, it works excellent on heel fissures. And those little distal fissures that you see at the tips, it's very difficult to figure out what to do with it. SkinIntegra is great because it just absorbs extremely well and hydrates the skin. In severe fissuring, I have combined it with an antibiotic cream once or twice daily, and then the SkinIntegra once daily, so you're hitting both things. I also often get asked the question if I use this with patients with tinea pedis as well. I use the same combo as like an infected fissure. I have them apply a prescription medication, whatever you prescribe of your choice, in the AM, and then SkinIntegra at night. I'm sure you often get patients come back and be like, I don't think that cream worked. But what you see is that leftover dryness from the athlete's foot. And so using this in combination with the antifungal really changes the clinical outcome for the patients because you're treating both at once. So I find this combination is excellent. Getting back to my patient stories. So I had a patient in my clinic last week. She had recently had a cold leg on the right and was immediately vascularized. And then she had a 90% blockage on the left. So you know that it's a limb-threatening issue. So I originally saw her post revasc on the right side, and the vascular surgeon was most concerned of the fissure on her heel. Right? We all know that that can turn into infection. We know that it can turn into an ulceration. They have tried so many creams. Even the vascular surgeon had prescribed things. And I had seen them initially a month prior, and I saw them again last week. And they were so happy with the results. The heel fissure was completely healed with the SkinIntegra. And then the vascular surgeon was very happy as well. She then had a 90% blockage on the other leg. And with that, you could see the profound skin changes. The revascularized, we all know that it was a little bit more perfusion. The skin was more hydrated. But on the 90% blockage side, the skin was hydrated, but of course had those ischemic changes. So in these high-risk patients, as podiatrists, it's so important to look at the entire patient and treat their skin and use the best practices. So I have incorporated this as part of my diabetic foot exam. So I always look at the skin. I look at their shoes. I look at the footwear that they wear at home because we need to look at the whole patient because prevention is key here. Next slide. So another couple of another cases here, we have calluses, of course, right? Runners, people that have persistent calluses in the area, SkinIntegra works great for that. And then that just dry, itchy skin. So I had another case where a dementia patient's skin was so dry, he kept itching it, which resulted in a hyperpigmentation and bleeding skin. So after one bottle of SkinIntegra, the skin integrity had improved so much that his wife was so thankful because her husband stopped itching his skin. It was impossible to watch him all the time. They had tried every other combination of over-the-counter creams. So that was another story that really made a difference. Just severely dry skin that SkinIntegra worked so well. Next slide. So I briefly touched on this earlier, so diabetic foot protocol integration. So really important to recommend a diabetic specific moisturizer like SkinIntegra. You really want to make it easy, right? And so we have to remember we play an important role in helping patients select the right products during any of our office visits. Prevention is key here. So you want to treat before it turns into an ulceration, like that high risk 90% blockage patient, right? We don't want it to turn into an ulcer. You want to make the routine really easy. So I say before bed, keep it at bedside. It's nice to build it into your post-op protocol with patients massaging their scars after suture removal. It's really important to sample and test as well. So I always get the question, how do you sell this product, right? My office does not have a lot of products that we dispense. I only change my protocol and change my products when I see a significant difference. I trialed this product for a few months and I had my patients calling Laurent about how profound the changes were. So my patients appreciate that I offer my advice and products that I recommend. I mean, we are the specialists, right? My price point is better than Amazon. So my patients return to the office to get refills of the product. And I like the flexibility that SkinIntegra offers. So dispensing it in the product is the best option, but you could also dispense it online, but it just makes more sense. So remember, trial the product is crucial. So patients calling the company saying how powerful their results were allowed me to realize that it's time to make the change from the other urea-based creams that I was using. I really also love their displays. They're beautiful. I leave the brochures in the waiting room and the patients will look through, and it's not just SkinIntegra, it's anything that I offer, any new products or any new modalities in my office. Patients ask about it. Usually they may be in for something else and they think, oh, I'm not going to talk to my podiatrist about dry skin. But when they look at the pictures, they're like, wow, I've been looking for something for my dry skin and my heels have been fissuring. So pictures are powerful. So they may be in for something else, but they may not think to ask you about their skin. The brochures and the displays really do work. So hopefully I gave you a little bit about clinical application. Again, I have so many stories I could keep going. I'd be happy to answer any questions at the end of this, but I left Sebastian with a little bit of time